might as well start. Hello and welcome. I'm Jorge Delva. I'm the Dean of the Boston University School of Social Work and the Director and Paul Farmer Professor of the Center for Innovation in Social Work and Health. Thank you everyone for joining us tonight on tonight's event called Taking Action for Health Equity, a Post-Election Analysis. When we scheduled this event, we had no idea about the outcome. And the one thing we knew, though, is that we're amidst the COVID-19 epidemic and continuing racial injustice, that the role of social work and public health in addressing health and social justice issues would be more important than ever before. This event is hosted by the Center for Innovation in Social Work and Health here at the Boston University School of Social Work, and is part of our Health Equity Speaker Series. Our goal at the center is to provoke thought and stimulate action consistent with the center's mission to expand the impact of social work in healthcare and population health. We define health in broad terms consistent with the WHO to include physical, mental, and social well-being, and to involve work at the individual, family, community, institutional, and societal levels. With the news that Joe Biden and Kamala Harris are the president and vice president-elect, respectively, I'm hopeful that the programs and policies that will be implemented in the future will be more in line with the values of social work and public health. Still, it doesn't mean our work gets any easier. As social workers, we'll need to find renewed strengths to partner with organizations and communities to heal and engage in positive growth. And we need to remain vigilant for the long haul. Tonight, our guests will help us explore what we can do in the coming weeks, months, and years to advance health equity, particularly in the Commonwealth of Massachusetts. After our conversation, we will have time for audience questions. Please type your questions into the chat window in Zoom, and we'll take as many as time allows. I'll let you know when that's going to be possible. If you're a social worker needing continuing education credits for this event, you will have received a link in your email confirmation to a quiz that you must complete to receive continuing education credits. We will also share this link in the chat. By the way, this event is also being recorded and will be available on our website. Our website is ciswh.org, ciswh.org. And now, let me introduce our panelists. I'm going to butcher your name, Rebekah. Rebekah Gewirtz. You'll pronounce it correctly later.
Oh,
I mispronounce all kinds of words, so my apologies, everyone. Rebekah is the Executive Director of NSW Massachusetts Chapter. She previously served as the Executive Director of the Massachusetts Public Health Association, and prior to that, served for more than 8 years as the Director of Government Relations and Political Action at NSW Massachusetts. Rebekah was also an alderman, now called City Councilor, in the city of Somerville for 10 years, representing the Davis Square area. Rebekah was a leader in the campaign to raise the minimum wage, co-chair of the Campaign for Our Communities, working with the support of nearly 100 organizations for a state revenue package that would be adequate and fair. And she was a founding member of the Welfare Coalition, fighting to secure and preserve state safety net programs for the most vulnerable. She led the Massachusetts chapter's successful efforts to advance social work practice through policy, including legislation protecting social workers from frivolous lawsuits, legislation protecting social workers against restrictive covenants, legislation providing social workers with Section 12 authority, and passage of social work safety in the workplace legislation. In addition, Rebekah led the chapter's political arm, NSW Massachusetts PACE, working with members to endorse and support candidates throughout Massachusetts who share social work values and priorities. She's a graduate of the University of Massachusetts McCormick Institute of Policy Studies, where she earned her Master of Science in Public Affairs degree. I'm also honored to introduce to you Carlene Pavlos, who is the executive director of the Massachusetts Public Health Association, a statewide organization and advocacy organization. MPHA is committed to health and racial equity and utilizes health equity framing in identifying policy goals. Since the early days of the COVID-19 pandemic, MPHA has been convening a task force on coronavirus and equity, a coalition of more than 100 organizations in order to focus on the needs of those most seriously impacted by the pandemic. Prior to joining MPHA, Ms. Pavlos spent nearly 20 years at the Massachusetts Department of Public Health, finishing her time there as the Director of Bureau of Community Health and Prevention. She brings to her work a commitment to social justice and addressing health inequities, including racism, misogyny, homophobia, heterosexism, classism, and transphobia. She also has extensive experience working with incarcerated women, a population at particular risk for violent victimization, and its associated health impacts. Carlene holds a BS from Lafayette College and a Master's of Theological Studies from Harvard Divinity School. Thank you, Rebekah, and thank you, Carlene, for being with us. I will now pass it on to you.
Well, thank you so much, Jorge, for that introduction. And it's been such a pleasure getting to know you and your role at BU's School of Social Work. I'm supposed to right now share my screen. So I'm going to do that and see how this goes. Okay, share. And now I'm going to put it in present mode. All right. So hopefully everyone can see my screen at the moment. When I was outreached about this, I was really excited to talk about taking action for health equity and talking about the election and doing a post-election analysis. So I'm gonna try to work to advance my slides while also speaking to you over here. I know this is being recorded. So what's interesting a little bit about my history is you've heard that I worked both at NASW and at the Mass Public Health Association. So it's a lot of fun to be here with Carlene Pavlos to talk about these issues. She's certainly a leader in the field of public health and has been for many, many years, and someone who I've just so much tremendous amount of respect for. So I've been waiting for this day, actually, where the two of us get to come together and talk together about some of these most pressing issues. So I'm just thrilled that today is that day. One thing that I wanted to point out just at the get-go is, I was at NASW for nearly 9 years as the government relations director. And I did all this work on social and economic justice and racial justice. It was my passion and just loved it. And then I decided I wanted to try my hand at being an executive director. And I was really interested in the Mass Public Health Association and public health and trying to understand more about the field and understand more about public health. And I got there and I was like, all right, I'm going to dive really into public health and I'm going to learn about healthcare. And I almost immediately learned that public health is social justice advocacy work. It's really kind of this incredible thing, campaigns like raising the minimum wage and advocating for people to have access to income supports and even closing corporate tax loopholes, other initiatives that get at why people are unwell upstream are at the core of public health. So these two fields, social work and public health, are really sisters. And it's just been the honor of my career to be able to work at both organizations, helping to lead and work with social workers and public health practitioners to advance these issues that I think are core to society. I have also often said that social workers were maybe the pioneers of practitioners working on the social determinants of health. The term the social determinants of health has come of age in recent years. It's something that a lot of people talk about. It's something that's talked about now in terms of reining in costs and reducing spending in hospitals and other systems. But social workers have always been clued into this. Social workers have always understood that people's problems occur not just in these one-on-one clinical settings, but that's what's happened down the road There are all these issues that have happened in the environment. So where they live, whether they have access to food and healthy food, whether they have access to the ability to get outside, whether they have access to all the different factors that make it possible to lead a healthy life. One main driver of whether people have access to those things is policy, right? So it's policy that we implement on the state and on the federal level. So what's really interesting today is to be able to have the chance to kind of take a step back and look at where are we now as we look to the future. So I was looking around for some cartoons to kind of capture what I saw as indicative of kind of the moment of where we are right now. And so yes, finally the election is over, and we have been waiting and waiting and waiting for this election to be over. I know many of us. It has been the source of stress and anxiety, and really for some people and many of us, this chaos that's been fomented, this sort of divide, this us versus them, no sense of like, we're in this together. So now that we have a new president-elect and vice president, there's going to be a lot of work to do to clean up what's happened over the course of the past several years. And in the course of this campaign, the divisiveness of this campaign and what's been fomented on the federal level that seeps down to what happens on the state level. None of us are immune from seeing what happens federally to how it impacts us on the state and local level. So, as I mentioned, social work is rooted in public health, and there are epidemics that we face. You hear this a lot now these days about the different epidemics that we face. So right now, of course, we've got COVID-19, and that's the reason why you and we aren't together in person in a lecture hall, interacting with each other. It's so obviously tragic. We're dealing with the COVID-19 pandemic, the pandemic of racial injustice and systemic racism in our country. We have a climate crisis at hand, and we have vast economic inequality. And I do want to put a special point on economic inequality, because I think it is what drives so much of what we see in terms of the divisiveness of now, is there are so few people who hold so much of the wealth, while everyone else is sort of fighting for the scraps. And those are policy decisions. Those are decisions that have been made at the federal level and at the state level to direct our communal resources to a certain few. Often racism has been used as a way to keep low-income white people and people of color at odds, so that nobody was looking towards the issue of very wealthy white people who have consolidated a lot of the wealth in this country. So we know that racism is a root, we know that economic injustice is a root, and we know that we have to get at these problems if we are going to find a way towards a more just society. So when we talk about a more just society, who is, so sorry, I realize I did not move my slide forward. This was the slide that was supposed to appear when talking about the items I just mentioned. So I wanted to just dive in a little bit to social work. Who are social workers? What are social workers, and what's the role that social workers play as we move into this next phase of our communal work together? So I love the social work mission statement. This is not just so you know, this is the overall social work mission statement, not necessarily the specific mission statement of NASW, although the mission statement does closely align. But the primary mission of the social work profession is to enhance human well-being and help meet the basic needs of all people, with particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty. And we back that statement up with the social work code of ethics, right? So many of you out there have had experience with the code of ethics. I don't know if you know, but I'm here to tell you that section 6.04 is really an important component of the social work code of ethics, where it says that social workers should engage in social and political action political action that seeks to ensure that all people have equal access to the resources, employment, services, and opportunities they require to meet their basic human needs and to develop fully. Social workers should be aware of the impact of the political arena on practice and should advocate for changes in policy and legislation to improve social conditions in order to meet basic human needs and to promote social justice. So in case you were ever wondering whether social work and the profession itself has at its core this mission, it is here for you in the Social Work Code of Ethics. So how can we start moving the needle? How can we take these things, the mission statement of social work, the Social Work Code of Ethics, and move towards action? So I have a slide here a little bit on what is NASW, just because this is one vehicle for how social workers can take collective action together. So you all might know that NASW is the largest membership organization of social workers in the world. There are close to 120,000 members of NASW. There are 55 chapters, so all 50 states, including US territories. And here in Massachusetts, we have just about 6,300 total members. We're the 4th largest chapter in the nation. We have 7 staff, regional coordinators. We have social work interns each and every year. And we have a program called Therapy Matcher that connects consumers to social workers within our network to help them access mental health care that is desperately needed. So getting together and working through NASW for policy change is one way in which social workers can begin to and can have always been able to make change. There is legislative and there is political action. So there's a national office. National has a national PACE committee and has priority federal legislation. And then here in the state level, we have a state level PACE committee that endorses in state and local elections. And we have priority state legislation that we work on. Let me advance this slide here just so you can see. So you can see this is our fun graphic that National produced when the National PAC endorsed Biden and Harris. So this was all over social media. It's really important that we have a PAC, and it's something that I always really like to point out, because you can do a lot of legislative advocacy work, but if you're not involved in politics, if you're not involved in the political arena, you're missing out on having a lot of influence. I can tell you that with legislators that we endorse on the state level, when we're involved in their campaigns, when we're talking to voters in their community or NASW members in the community, they take note of that and they see us as a partner on both sides, on the campaign side, and then we work together legislatively to advance our priorities. Not all professional associations have PACs, actually. Many don't, because of this concept of staying away from the political side, that we don't want to get involved in politics. But it's important to note that we do. Some don't have them just simply because it just doesn't work out that way. The way they're incorporated just doesn't work. So it's lucky that as a membership association that's national, we're able to do this. So what can you do here on the state level, and what are some of the things we have been working on? So I wanted to share with you a little bit about our legislative and political action activities here in Massachusetts, and note the ways in which people can get involved as we think about the post-election time. So we had this election, we had a federal election, we had a state election, and now is this moment where we're really looking to what are we going to prioritize, and we focus here in Massachusetts on the state level in terms of priority bills that we want to move forward so that we can see forward our vision. So we have these various ways that people can get involved. You can get involved in our legislative advocacy committee. We have a racial justice council, which I'm happy to talk about in more depth. We have a legislative alert list. And again, we have PACE, political action for candidate election. We have a criminal justice committee. And then we have all different kinds of committees, commissions, and shared interest groups, all of whom actually weigh in on how our legislative agenda is set. Over the course of this past session, we've had some really exciting victories for social workers and for social justice. Some of these victories and these initiatives have a lot to do with health equity, because again, coming back to what I said at the beginning, when we're working on issues of social justice and we're working on issues of access, we're addressing some of the social determinants of health. So let me just give you a brief overview of our legislative agenda, and then I'll walk you into where we're going with our legislative agenda into the future. So we've worked on some social work professional practice issues. I will tell you that this legislative session has been a record for us. We've had 5 priority bills move into law. In all my years at NASW, we would have maybe 2, or, a good year we'd have like 3. So it's been a really, really good year for advocacy. We've had so much engagement from our members. There's just been a lot of interest in being involved legislatively and politically that we hope will carry forward into this next session too. So we passed a bill limiting clawbacks on mental health providers, meaning that insurance companies can't pull back money they've already paid for a mental health visit. This was really important. People didn't know that actually this could happen, that you could provide a service, or people didn't know that social workers could provide a service, and then maybe 5 years down the road, an insurance company would say, actually, we're not approving that anymore, and we're going to pull back the money. This discourages people from being on insurance. It discourages people from accepting insurance, and that hurts low-income people, vulnerable people, people who are living in poverty. We want to make sure that as many social workers and as many practitioners of mental health as possible are involved with insurance companies and on networks. Now, what we find is that many of our people want to get on networks that are closed, but that is a different issue that I'll come to in just a moment. So that bill, we worked really hard with partners and allies, and it passed into law this past year. So no more can there be these clawbacks after 1 year has passed, unless certain specific instances. And if you're interested in this and you want to learn more, I'm happy to talk with you offline too. Another bill that we got passed into law was a bill that would eliminate insurance company ghost networks. So that relates to what I was just talking about. When you have these networks that are full, supposedly, of social workers and others, and then the insurance company says, sorry, no new social workers can get on because we're full. What we were finding is actually many of those networks were actually not full, but the insurance companies were kind of like carrying them over. People had maybe moved, providers had maybe like died or left or whatever, but they weren't being updated at a regular enough interval. So now they're being updated more because this bill was passed into law. We've been working for years on loan repayment for social workers. There's been some movement on that with respect to DSRIP funds. And I don't know if Carlene may or may not talk about the Medicaid big bunch of money that came into the state. Part of it was to support workforce, and some of it is loan forgiveness that benefits social workers. So then on the human rights side of things, we had our bill that would ban LGBTQ conversion therapy passed into law. We were really important in that debate because we could talk about social workers doing therapy and how conversion therapy is not therapy at all. In fact, it's the opposite. So that was a really big win for us and for work with our LGBTQ friends and allies. So we've continually worked on protecting immigrant communities, the Healthy Youth Act, and another huge victory for us was repealing the family welfare cap. Massachusetts was one of only a handful of states that had a welfare cap on kids, and what this means is that if your parent had a child and then had you after having that child and was receiving assistance, you, that second child, were treated by the state like you did not exist. No benefits were provided to the child, including the yearly children's clothing allowance. And it's just like so wrong. The whole concept behind it was somehow it was going to disincentivize people to have more kids. It had nothing to do with that ever to begin with. So it was also a policy that was steeped in racism. And if you look back at some of the floor debates and discussions around it, you see that really heavily present. So it was really important to us to repeal this. We were a leader in that coalition. It got repealed. It was really a great victory. We also work on issues of raising progressive revenue and criminal justice issues like raising the age of juvenile jurisdiction. The last item that I'll just mention from our agenda that we're leaving is the SNAP gap. We're the co-chair of the coalition to close the SNAP gap basically there are all these people in Massachusetts who receive Medicaid, but who don't know that they're also eligible for SNAP. And that's called, so there's this gap. It's an entitlement program, SNAP. And so we're trying to make sure that everybody who's enrolled in Medicaid understands if they're eligible for SNAP and can automatically be connected into the system. So we got that with coalition, working with our partners, working with allies, passed into law as part of the budget. So where do we go? Oh, and I'm just going to move through the slides over here. I just want to make sure you can see all of the slides here. The SNAP gap passed into law. All right, so where do we go from here? I'm looking at the time and I know that I want to kind of not take up all the time, because certainly we want to hear from Carlene, hear from you with your questions. So we're looking at our next legislative agenda, and it's 2 years in Massachusetts, the legislative session. So it begins in January 2021 and will end basically in July of 2022. This year, we've decided that we're going to build our agenda based on Dr. Kendi's 6 policy areas to remedy racial injustice. And those areas are criminal justice, economics, education, environment, health, and politics. We also added, of course, professional practice issues, which also can help with alleviating some of the stressors around racial justice. So I'm really eager to get our agenda in place. You can see I put on this next slide here just some examples of what are policy solutions to some of these larger issue areas. So one bill that we're going to file this coming session that we're really excited about is a reducing police contact through enhancing community crisis response. And this is there's a federal bill that was recently filed. Our national office is working really hard on this with Congresswoman Bass that would try to divert calls away from police and to teams of social workers and other folks on the ground who are working with and in communities. So to try to take people who are armed, police officers, out of certain situations that they don't need to be in. So we are basically using very similar language as what's been proposed federally here in Massachusetts, and we would love to have you engaged and involved in this work. The co-chairs of our criminal justice committee have been very involved in helping us to craft this as well. We've had some great conversations with legislators, and we need to hear from folks on the ground, so social workers on the ground who are doing some of this work in community around crisis response as we move the bill forward. We're going to work on treatment, not imprisonment. We're going to then, when we think about economics, we're going to do more welfare advocacy. Lifting kids out of deep poverty now is a big priority for us. Right now, welfare grants have not kept up with the cost of living, and they haven't been increased in 20 years. And so we're working with a coalition that has successfully managed to get an increase included in the House budget. We hope that the Senate will follow suit, and there'll be work done there in conference to make sure that there's an increase because people who are living in deep poverty are suffering probably the worst, in this pandemic. So you can see all the other kind of examples. I won't walk through each and every one of them, but I did want to put them here because I know we're talking about where can we go into the future. This is where we're headed into the future, and we hope that you will join us. I wanted to also point out just a couple things about the Massachusetts legislature that you might not know. Sometimes people quite understandably get confused between the federal government and the state government. So just briefly, so you know, this is what we do at the Mass chapter when we're trying to engage our folks in advocacy. Is we kind of follow this testimony flow chart where we sort of learn about that our bill is coming up for a hearing, and then the process of informing people, engaging them, bringing folks in, helping people write testimony. Normally we'd be in person. It's a little different. It's a lot different in this virtual environment. But this is so you can see a visual of how we try to bring people into the process, bring you into the process, hopefully, if you're interested in being more engaged in this kind of policy work. And also just to give you a sense of what we're looking at in terms of the Massachusetts legislature, just so you know, the Massachusetts House of Representatives has 160 members. Each of you has a state rep out there. Most of them are Democrats. There's a small number that are Republicans. One is unenrolled. In the state Senate, there are 40 state senators. There are 160,000 people about in each senator's district. You can see this is who the Senate president is Karen Spilka. She's actually a social worker. We're giving her an award at our upcoming awards event on December 1st. You can see that it's a heavily Democratic branch, and it's even more so now. I think Republicans might have lost more seats. I have to check the numbers. But so we at NASW, we are nonpartisan. We work with people on both sides of the aisle, and those relationships and those connections are really, really important to advancing our agenda. So taking action together, sometimes you hear some myths like my action or what I do isn't going to make a difference. That's probably the thing I've heard the most. Well, it's just me. Like, how am I going to make a difference? And what I say to that is, you would not believe this, but just 3 phone calls into a state rep's office has people on alert. Like, what's going on? What is this issue? The rep has to learn more about it. There has to be follow through, and they have to that's how few people actually contact their legislators. And I can say this from personal experience because I was a legislative aide in a state rep's office. And seriously, when we started hearing people picking up the phone and calling, I mean, it was amazing how few people it took before we were on an issue. So you can make a difference if you call, if you email, particularly if you call, but if you email also, it does make a difference. And especially if you're registered to vote, your representative is going to notice that. And same with your senator too. Senate districts are decidedly bigger than rep districts, but still it makes a difference. Then I hear if I testify, it won't matter because there are so many other people testifying. I have to wait. It's not worth it. I can tell you that the social work perspective at these hearings is listened to. People trust social workers, legislators trust social workers. They want to hear from social workers about both their clinical experience and then how that clinical experience translates into this macro policy space. That's sort of what the brilliance of the profession too, is that it has these 2 tracks, is that you've got the clinical piece where you're working with people, you're seeing their experience, and then you can translate that into what kind of policies we need to address some of the issues that we see on the individual level. So it does make a difference when social workers testify. And then I hear I don't have time. I'm just so busy. And yes, we are all so busy. But if you take action on the state level, you can actually feel that action. It is a little bit different than federal advocacy, which can feel more removed. You can't necessarily talk to a congressperson or a US senator, but in the state level, you can get in with your state rep. You can often get in with your state senator, and you can actually make a difference in conversations with them. So lastly, I just wanted to provide some member testimonials, people who've said they've had these great experiences when taking action with NASW and what their experience was and why it mattered to them. And then reviewing finally, again, going back, what we can do, what you can do if you want to get involved in the year ahead as we work together for justice and ultimately for health equity in the policies that we're pursuing. So you could do any of these 5 things listed here. And then if you're not a member, please join. We'd love to have you. We need all social workers in our membership, and you can see all the different member benefits. And I can answer any questions about chapter member benefits for anybody who's interested individually. Sorry, I keep blowing it here. There you go. So this is our fancy swanky member benefits slide. So just let me know if you have questions and you want to learn more about becoming a member, joining. And then this is my contact information. So I'm sure this will come up at the end too. And I'm, again, just so pleased to be here with you all tonight. I wish I could see you in person, but I know you're out there. And Jorge, thanks so much again for having me and for all the work of the Center for Innovation in Social Work and Health. I just am so excited about the the organization and the entity and what it will do, what it is doing even now, bringing us together to talk about these important issues. So thank you very much.
Thank you. Thank you very much. And we'll have some questions already coming up, but we're saving them towards the end. I'm looking forward to Carlene's presentation. Thank you.
Great. Thank you so much, Jorge, and thank you, Rebecca. I am going to start sharing my screen. I'm hoping folks can see that I've shared the right screen. I am really thrilled to be here. Like Rebecca, I have been sort of waiting for an opportunity to get to be here with a sister advocacy organization and get to be on a panel with Rebecca. So this is just a really wonderful opportunity for me. Rebecca, as my predecessor at MPHA, it's an honor to be here with you. I'm also really happy to be with all of you out there. I think we now have, I'm trying to see, there are over 100 people on the webinar tonight. I wish I could see your faces, but it's great to be here with all of you today. So I'm going to talk a little bit. Jorge has introduced me earlier, Carlene Pavlos, as the Executive Director of the Massachusetts Public Health Association. So I'm going to talk a little bit about the context that we're in right now, and then how MPHA is responding to that context at this political moment. So first, I want to say right off the bat that I am starting with a slide that is sort of devastating with its bad news, but I want you to stay with me in this presentation, because I'm going over these at the beginning, not to depress all of us, but because I'm hoping that these bullet points here like light a fire of indignation in you and make you feel what I feel, which is that we need to do something, we need to act. So first, as Rebecca pointed out, and I think it's of course perfect that the two of us are mentioning the exact same public health crises we are in the middle of. We are currently facing a COVID pandemic, an emergence of the reality, at least for white people, of the fact of structural racism, of 400 years of structural racism, and people are beginning to name that as the public health crisis that it is. We are experiencing economic devastation, which is not new to people who live in poverty, but it is exacerbated by the economic downturn because of COVID-19 and the public health strategies that have been put into place to try to curb the pandemic. And of course, we are facing what we're beginning to recognize now as an existential threat of environmental destruction and environmental injustice. All of these public health crises are embedded with inequities that are because of racism, right? Inequities by race and ethnicity in each and every one of these public health crises. I also want to remind us of where we are in terms of the COVID pandemic. We hear a lot of the numbers, I think the national numbers, but here in Massachusetts, we have lost 10,000 people, more than 10,000 people to COVID just since March. More than 170 have died in the last week alone. We have more than 800 people currently in the hospital in Massachusetts. And today, again, more than 2,200 new cases were reported. Our local public health system is completely overwhelmed. And I'm going to talk a little bit about that at the end and what we could be doing about that. But local public health is already overwhelmed, and we're going to start seeing perhaps healthcare become overwhelmed soon. We did just complete the national election, and there's some good news, obviously, that's come out of that. Huge numbers of Americans voted, more than ever before. As Jorge said at the beginning, with President-elect Biden and Vice President-elect Kamala Harris, we hope for some real improvement in efforts towards justice, but more than 47% of those who voted for someone with, and I don't say this from a partisan perspective, but from a simply factual perspective, that more than 47% of people in this country voted for someone with overtly racist views and policies, with no comprehensive national plan to address the COVID-19 pandemic, and with a true resistance to relinquishing power in alignment with our basic historic standards of democracy. So there's something to really think about there, that and a lot of work that we are all going to have to do to address that reality. At the same time, here in blue Massachusetts, Charlie Baker is our governor, and there has been little to no attention by this particular administration in policies that are about centering equity. And right now, I'm just going to highlight those that are associated with the COVID pandemic, but there are examples that predate COVID that we could certainly be using to make this assertion that the Baker administration really is not attending to issues of equity. Some of those for now are, there has been no action on decarceration. And what that means is our prisons and jails are petri dishes for the spread of COVID. And people who are incarcerated cannot take the public health precautions that the rest of us take for granted to keep ourselves safe from this virus. They cannot socially distance. They don't have access to disinfectant, even to hand soap often. Often they don't have access to warm water to wash their hands, and certainly not to disinfect surfaces. And there are clusters of COVID, again, resurging in our prisons and jails. There has been no call for, have been calls, but no response to decarcerate those prisons and jails. We have had no executive action on emergency paid sick time. There has been a completely insufficient response to the eviction crisis since the moratorium on evictions ended. And the state's data reporting is incredibly opaque, and it really obfuscates the inequities that exist by race and ethnicity in the COVID case numbers, both in the illness, in hospitalizations, and in deaths. And by the way, I just highlighted those. And if you can look and read this list of these bullet points, and it doesn't make you think things need to change, I don't know what will. My goal this evening, and Rebekah already made strides towards this goal too, is to get you to believe that you can be part of making that change. But first, I do need to take a couple steps back to do just a little bit of like level setting on what MPHA is and why we work on the issues that we work on. So MPHA, the Massachusetts Public Health Association, this is our mission statement right here. And as you can see, built into our mission and built into our very DNA is work to eliminate health inequities. It's also our tagline, Action for Equity and Health. This is at the heart of what we do. And at MPHA, as we focus on inequities, we use a leading with racism lens. So we begin by centering the inequity of structural racism and then look at the intersections with other forms of oppression. So our role at MPHA is primarily organizing, educating, and advocating for policy change. That's what we really do. And we do this at the state level. So we work within Massachusetts. We work on legislation, we work on the state budget, and we work with state agencies that have regulations or practices or fund, procure, we call it, it's a big bureaucratic term that basically means fund community-based organizations that deliver services. And so we work at all of these levels of policy and try to influence them for greater justice and health equity. Now, I want to pause to make a couple important points here. The first is that MPHA is a membership organization, but we do not do this advocating on behalf of our members or even on behalf of the profession of public health. Rather, our members support our work. They want to be part of the movement for greater justice and health equity. So we are a membership organization, but not as much a professional membership organization. We're an advocacy organization supporting a movement for change. And the other thing I want to say is that because we work with our partners to promote healthier communities and greater health equity, we need to really understand what makes us healthy in the first place. And Rebekah has talked a couple of times this evening about the social determinants of health. So I just want to make sure that we're all on the same page about what we mean by that. This is a pie chart that I use a lot. This is from one particular study that's 20 years old now. It's sort of a bedrock foundational study, but there are others. In fact, there's a whole literature that looks at what are the factors that contribute to make us healthy. And I think when most people think about that, they think about access to healthcare and do we have quality healthcare and our own biology, our genes, right? Like how we're made up. But when you look at what really makes us healthy, that's only about 20%. Those green pie wedges there is only about 20% of the picture. What really makes us healthy are the physical environments and social and economic factors, and then the health behaviors that they allow us to take, right? Our health behaviors are obviously really conditioned by like where we live, where we work, where we play, what our physical environment is, and what our social and economic circumstances are. That is about 80% of what makes us healthy. So the majority of what makes us healthy are these blue pie wedges here, and that's what we refer to often as the social determinants of health. And I'm going to say more about those in just a second. I do want to say this does not mean that those green wedges are not important. Healthcare is incredibly important, especially if you're sick, right? But at MPHA, we focus less on issues like the Affordable Care Act and more on what keeps people healthy and well. So this is another way just of visualizing the social determinants of health. These are the social determinants that in particular are state. And in fact, the Department of Public Health uses. They talk about violence and education and employment and housing and built environment, which has to do a lot with transportation and the way our streets are built. And those social determinants of health are further influenced by root causes of inequity, right? And those root causes of inequity are forms of oppression. And again, we've put at MPHA, we would put structural racism in the center of that. It's sort of the air we breathe or the polluted water in which we swim, and it's connected then to all other kinds of oppression around economic injustice and xenophobia and homophobia and ageism, and I think you probably get the point. So how that ends up showing up in our work is that MPHA's goals and priorities are really related to that analysis of the social determinants of health and root causes. So our overall cross-cutting goals focus on dismantling structural racism, reducing poverty, and integrating health equity into all kinds of policies. And what we mean by that is we don't just work on policies that are the purview, for example, of the Department of Public Health, although we do work on some of those, or even Medicaid. But we work with the Department of Transportation, the Department of Housing and Community Development, the Department of Agriculture, because we work on key social determinants of food, housing, and transportation equity. We also do a lot of work around promoting equitable and effective public health infrastructure and the public health system that exists in Massachusetts. And I am going to say just a couple words about that at the end of the presentation. And then there's some of our policy priorities also do focus on helping healthcare think more upstream, more about the social determinants of health and the what we call health-related social needs, like do you have a house? Do you have healthy food? Do you have means of transportation to get to your doctor's appointments, to get to your job, to get to your schooling, to your education? So those have been our policy priorities and our overarching goals now for this past legislative session. And Rebekah just told you that we are coming up to the beginning of a new legislative session in January. But this year, our legislative session has been really delayed. Usually we would have been done with it in July, but because of the COVID pandemic, we have seen a really major delay, and the legislature is still in session and still working on a number of these priorities, but some additional work too. And I want to talk a little bit about that right now, basically about MPHA in the time of the COVID pandemic. So early on in the pandemic, we recognized that the typical patterns of oppression, of racism, of poverty, and of xenophobia would be the patterns that would influence how COVID impacted Massachusetts. So we knew we would see inequities, not just of the COVID infections itself, but of the actions that were taken to try to stem the tide. And unfortunately, we were right about that. Fortunately, we had in the early days, pulled together a task force on coronavirus and equity, which has more than 100 organizations that participate in the task force, from small community-based organizations to larger associations that focus on health and human service needs, to unions and universities. We have a whole range of organizations that have come together and meet weekly since March to focus on policy priorities that can address equity. And we believe that by acting together and doing it as quickly as possible, we can really impact what is happening and the policies that are helping to mitigate the impacts of the COVID pandemic and its economic fallout. And I also want to say that one of the tenets of the task force since the beginning has been that we are listening to the voices of people from communities that are hardest hit, that we are listening to communities of color, we are listening to low-income communities and to immigrant communities in particular as we make decisions about the policies we're going to prioritize. And the task force has prioritized a whole range of issues. We have done a lot of work around data collection, and we're successful in passing a law that requires the Department of Public Health to collect and report on a variety of data elements so that we can help to so that it can help us to understand inequities that we're seeing. But we've also worked on housing security and safety, workers' rights and safety, health and safety for immigrants, a whole cluster of work around progressive revenue. And that's a way of describing assuring that our tax structure has people who can afford it and people who are doing well during the pandemic pay their fair share of the state budget. We've worked on police accountability, again, on decarceration of prisons and jails, and right now are putting a lot of effort into commenting on demanding equity be centered in the vaccination plan and the distribution of any vaccines that finally come to market. I have highlighted on this slide in blue bold those things that are current urgent advocacy opportunities. Emergency paid sick time and the budget amendments on progressive revenue are things that literally this week are being argued and acted on for the fiscal year 21 state budget. And that's the fiscal year we're currently in Massachusetts. We are also making current demands of our legislature or of the governor to act by executive order to decarcerate our prisons and jails. And again, there are opportunities to weigh in on the vaccination plan. Another huge amount of work that we have been doing during this time of COVID has been addressing the need to transform our local public health system. The pandemic has shown what we've actually known for quite some time, which is that the local public health system in Massachusetts is simply not actually adequately structured, it's not adequately staffed, and it's certainly not adequately financed to respond to a public health emergency. And we've seen that during COVID. And just so that you know how important this is, local public health is responsible for things like investigating cases, recommending quarantine and isolation, and enforcing quarantine and isolation, making recommendations for who gets tested and how that testing happens at the local level, reporting all of this data to state officials, and enforcing the regulations around reopening that businesses are expected to comply with. So local public health is where our the health and safety of citizens across the Commonwealth are depending upon local public health. And yet we have a crazily decentralized local public health system in Massachusetts, where every single one of our cities and towns, that's more than 350 of them, have their own board of health. They have no dedicated state funding or staffing requirements to carry out those actions. There are just huge inequities across municipalities, and it endangers all of us. So MPHA and the Coalition for Local Public Health are working very hard to change that by passing what is called the SAFE Act, the statewide Accelerated Public Health for Every Community Act. And right now, again, there are opportunities to work on that by embedding it in the state budget that is moving forward right now. Literally, right now, the Senate is working on the state budget. And next week, the entire legislature will come together in a conference committee to be working on the state budget. So I wanted to go through all of this quickly. And say, if you are interested in any of our priorities, whether it be the priorities of addressing structural racism or particular priorities around housing and homelessness, around addressing issues of immigration, around addressing issues of criminal justice, if you want to take action to make those changes now, if you want to work with others in collaboration from the broadest range of partners, and if you care about local public health, you can join us in this work. There are lots of ways to do it. You could come to our annual conference, which is happening on December 8th, and it's free, by the way. You can become a member of MPHA. You can join the Task Force on Coronavirus and Equity. You can join the SAFE 2.0 Coalition. That's the Public Health Action Coalition. And you can follow us on Facebook and Twitter. And this is how you would connect with us to do all of those things. You go on our website, mapublichealth.org. You can contact me or our policy director directly, and we'll connect you with any of those opportunities. So I'm now going to stop sharing my screen.
Thank you, Carlene. What an insightful presentation. Thank you. And I'm glad you went from the challenges to what is happening and the opportunities, or we would all go to bed needing to eat ice cream to deal with the sadness and rage and fear that we experience. Thank you very much. Thank you both for your amazing presentation, for your important work. So I have some questions that audience members already have asked, and I'd like to start with a question that I have that is actually link to two of the questions presented, and then as we engage in conversations, people will invite the audience to type in more questions, and I'll try to capture the essence and ask them to both of you, Rebekah and Carlene. So the first question captures two items that people mentioned about one indicating that the Biden-Harris COVID task force announced last week that they did not include any social workers, and apparently neither did include nurses. And then another person commented that as much as we know, social workers are pioneers, are working in the trenches, particularly with disenfranchised communities, that we don't hear as much praise of the work social workers are doing compared to other professions. So the question related to those two comments that I have is, how or to what extent are both your organizations involved influencing or attempting to influence the Biden administration? Are you engaged at a state level in that process, or are there related opportunities in the transition process that you've been examining that you might be able to share tonight with us?
Do you want to start, Rebekah?
Sure. So as I mentioned during my presentation, NASW is a national organization, and then there are state chapters. So actually just earlier today, I had the opportunity to have an advocacy call with the national office and a bunch of the other chapters to talk about this transition period and what's going to be happening and what is national going to be doing. There is a memo that's being created about the key priorities of social workers that's going to be circulated with folks inside the transition team. I agree. I think social workers absolutely need to be at the table in the thinking about COVID and the future. We know that social workers not only are helping patients when they come into the hospital, they're the person who's in the hospital who's listening to the doctors and other colleagues who are struggling themselves. And we hear a lot about social worker burnout. So how are we making sure that we are lifting up this profession? That, you know, social workers are often doing things without recognition. That's sort of built into their DNA, if you want to talk about DNA. But we need to recognize the work of social workers. That's what helps keep people going. That's what helps keep people feeling engaged and feeling valued and feeling appreciated, is being recognized and acknowledged. So I completely agree. I think social workers need to be at that table. I'm really pleased that our national office is on this and is moving forward with advocacy with the transition. And you know, so we'll see where that goes. We've made some good headway this year in terms of our national advocacy work. So let's hope for even more in the year to come.
Thank you. And I know I'm a member of various national organizations that are also partnering with NSW and others to try to influence or call into attention into the Biden administration, the role, importance of social workers.
Can I add just a note about this? I have to say that it is just such a joy that the Biden administration is paying attention to science, right? Like science and epidemiology and public health and infectious disease experts is such a step forward that I almost feel like what I need to do right now is admit that I haven't looked that critically at who's missing from that list, because I feel this just sense of euphoria that there's going to be both science sitting at the table and a belief that this can help improve our response to COVID, and that there's going to be a national plan, because we desperately need a consistent national plan, and we need consistent guidance from the federal agencies that we've always admired and felt were acting with integrity and the public's best interest at heart, generally speaking, and now have just fallen to pieces in many ways. So I think it's a really important question. There are lots of folks in the Massachusetts public health community that are working both with the American Public Health Association and with others at the CDC to try to, and with members also who are on the task force, because frankly, some of the leadership of the task force is located right here in Massachusetts, to try to get some of the issues that we've raised in terms of equity on the table for that, the transition task, the COVID transition folks.
Thank you. And I share your sense of relief and enthusiasm and promise for the future, despite the hard work that we have to face. A comment someone made, and I believe that was answered earlier, was someone asked, I'm a licensed clinical mental health worker, licensed mental health counselor, my apologies. Can I still get involved? And I think both of you provided a number of opportunities to do that. I'm going to place in the chat the two websites for both organizations, so people can, who may not be familiar, can go there and learn more, as you both indicated. And of course, you provided the contact information. Thank you for doing that.
Yeah, NASW, you don't actually have to be a social worker to be a member. We have a bunch of LMHCs who are members because they appreciate our, clinical advocacy work. So you can become an associate member, and you can find out more about that on our website.
Thank you, Rebekah. Carlene, as you were also talking about the need to pay closer attention to the individuals who are incarcerated, someone has an interesting comment, said, how can you ensure incarcerated individuals are rehabilitated enough to be successful post-release? The implication is the following question is, are we releasing people to prevent one issue, but creating another? You're mute.
So the legislation that that MPHA and the task force has endorsed there are criteria for the release based on age, based on pre-existing conditions, the reasons for incarceration, and there are right now incarcerated in Massachusetts more people than at the beginning of this pandemic. We are increasing the crowding of our prisons and jails right now, not decreasing it. Other states in this country, including most recently New Jersey, have released thousands of inmates and inmates, by the way, forgive me for saying that, people who are incarcerated. They are people first, and other states have successfully released thousands of people who are incarcerated with no impact on community safety. This bill is endorsed by the Suffolk County District Attorney, Rachel Rollins, who spoke at a press conference earlier. I'm trying to remember, it was actually last week, spoke at a press conference with Prisoner Legal Services and with Congresswoman Presley and myself to talk about decarceration. There is ample evidence that we can decarcerate prisons and jails safely and avoid unnecessary death. Because remember, Massachusetts does not have the death penalty, and yet we are keeping people, some of whom have already been paroled, but the action to release them hasn't yet been taken. And we are keeping them inside prisons and jails where they are unable to protect themselves from what is a deadly disease. It is unconscionable. I should say, in transparency that I've spent almost 30 years going into the women's prison in Framingham. I have friends there, and it is a personal issue to me as well as a professional issue to me, and is absolutely a public health issue. And I just have to add one other thing, which is that infectious disease does not remain inside the walls. The people who work in the prisons, whether they are the healthcare providers or the officers who go in and out, or volunteers or program providers, go in and out, or social workers, exactly, Rebecca, go in and out of the institutions. And when there are these surges, when there are these epidemics inside these institutions, they bring that out to the general community. This is it's an unacceptable public health risk.
Thank you.
And it's just inhumane. It's not what a humane society does. So, you don't keep people. We're supposed to be released on parole anyway, locked up inside where they're susceptible to the virus and then infecting other people. It's just totally unacceptable approach. And then for a while, they were putting people in isolation as a way to try to say, oh, we're keeping people safe. But that the mental health consequences of people having to be in isolation are vast. As we all know from our experiences of isolation, to a certain extent, it's not like that, of course. Like, it can be devastating. So that's not a solution either. The solution is people should be released who can be released. We really need to evaluate the prison industrial complex in and of itself.
Thank you both. Thank you for those insightful answers and your passion. It sort of comes across. I think I hear you.
I didn't even talk about the way in which it's also an incredibly critical racial justice issue, right? It is an incredibly critical racial justice issue because the entire criminal legal system in Massachusetts, as in across the country, has built-in racism to it. And so we are talking about exacerbating the disproportionate impact on people of color by keeping people unnecessarily incarcerated. So,
as you're describing your work and answering questions, one of the things that I hear is that to address these problems in society, it requires collaboration and working with multitudes of people and organizations, and that comes across. Before I ask more of the questions of the audience, a question I have is, in her book, The Purpose of Power, Black Lives Matter co-founder Alicia Garza says, movement building isn't about finding your tribe. It's about growing your tribe across differences to focus on a common set of goals. What do you think of that? And do you have any current or prospective partners in your work to advance health equity that might surprise us?
Oh, here is what I say to that. We cannot close divides. We cannot win on big policy priorities unless we're willing to talk to people outside of our bubbles, outside of our circles. And that starts with a sense of empathy, is trying to understand where are other people coming from? Someone who might not view this from the same lens as I do, from the same perspective as I do. Why do they view things the way they do? How can I meet them where they are? How can I understand their point of view so that we can kind of come together as two human beings to be thinking about what's the best path forward? If we're only ever putting our heads down and saying, everybody else is wrong, I'm right for all these reasons, we're missing it and we're not going to make change. That is not to say that we shouldn't be radical, right? I think we should be radical and we should be smart about it. That's the thing, is that I think too often it's like, I'm a radical, I'm this way, anybody who's that way doesn't understand and they're wrong and they're out. And that's antithetical, I think, to the movement. I think the movement should be to bring people along. The movement should be, you know what I also want to say? I'm sorry, I'm just going to say it. like there needs to be some fun in this, some joy that comes into some of these meetings. You know, you sometimes go to meetings and everybody is so angry at everybody else that half the time you spend time in the meeting just worrying about anything you might say that might anger other people, and then you're silenced. So I know these are heady issues. These are really serious issues. When I was first starting out at the in Somerville doing my advocacy and organizing, and we started the Progressive Democrats of Somerville, we started with a very small group of people that grew and grew and grew. And we had, one of the reasons people said they kept coming to these meetings was because they were fun. They enjoyed each other. They laughed a little bit. It was their free time. It was the time they were volunteering. And they knew there was this very important ultimate purpose and goal, but they were also trying to enjoy each other, enjoy the experience. And in that way, spread by word of mouth, the good things that were happening in a positive way to move our leftist agenda forward.
So can I just build on that a little bit?
Sure.
One thing I would say about that is it reminds me of really important work around what characterizes white supremacy culture, and this I know best, right, of white supremacy culture, Rebekah, and I think you're really right. Like, it is our obligation, if we are going to work in, say that we're working towards health equity, to really do that in a way that breaks down the way in which white supremacy culture has so often operated, and that means listening in a different way and being with people in a different way. I think from MPHA's perspective, we are increasingly, I mean, one of the things I'm proud of about the Task Force on Coronavirus and Equity is that we have, through that task force, expanded our network of organizations, and a lot of the organizations that we are now working with much more closely are grassroots base building organizations. And we have a lot more work. I just want to say MPHA has a lot more work to do in that regard. We have recently, through a strategic planning effort, recommitted ourselves to listening to the voices of communities most impacted and the people most impacted by racism and economic injustice. And we have a lot to do to make that real and true, and are committed to doing that, and working in developing our policy priority agenda for next session by doing that in a real and very practical way. There was a question in the questions and answers about diversity, equity, and inclusion to our own institutions. We've been thinking a lot about that at MPHA. One of the things, we do not ask for demographic information on the people who join us as members, but we do pay a lot of attention to the racial diversity and representation of both our board and our staff. We also, and our policy council, excuse me, I'm also forgetting our policy council, which develops our policy agenda and recommends it to the board. And we have a majority people of color on both our board and our policy council, and are working to diversify our staff by race in a way that is more genuine and reflective of who we are, and have been able to do that. And we use a health equity policy framework that asks for pretty simple questions of the policies that we endorse. And one of them is, have the people who are impacted been part of the process of developing the policy recommendation? Because that is really critical to assuring that we're listening to the voices of people most impacted. So then I just want to say one other thing, which is a quote from one of my current political heroes, Ayanna Pressley, who says that joy is a form of resistance. So just in echoing, Rebekah, one of the things that you said about having fun in these moments of national crisis and Massachusetts crisis and looking into what has at many moments appeared to be the true abyss in the last 4 years, that having, being part of the resistance has been really important. And the only way to maintain that is by highlighting and feeling that sense of joy sometimes. So I couldn't agree with you more, Rebekah. I think that's really important.
Thank you. Thank you. A couple more questions. We have about, I'm always cognizant of the time, about 8 minutes before ending. I think there's time for a couple more questions.
A very small person might run into this room.
Oh, that would be lovely.
That's what a word that does.
That would be totally welcome, actually. Part of the joy of what we have to do, right? Embracing those lovely individuals or pets, as we've seen, or in some cases, spouses who creeps in. That's why I'm at the office today, so that wouldn't happen. And thank you, actually, Carlene, you did answer one of the other questions that was asked. Another one is, does MPHA endorse candidates? Where does MPHA stand with the ACA, which impacts so many of us?
MPHA does not endorse candidates. We are a 501c3, and we don't endorse candidates. We, in terms of the ACA, of course, we support healthcare access, but that's not one of the areas in which we primarily work. Here in Massachusetts, there's an amazing organization called Healthcare for All that we support their work and they're true partners with us. But they take the lead on healthcare access questions. Again, we clearly support the ACA. We support having access to healthcare for everyone. It's not so much our lane.
Thank you. Thank you. There are a couple of mentioned comments about that the Biden-Harris task force does not seem to include anyone related to the aging population. And someone also makes a comment about the social workers in the nursing homes and what they've had to go through with the extent of dying that has occurred. I cannot imagine what that it's like during these times. My wife is a gerontological social worker who practiced a long time ago with the frail elderly, and our conversations were generally about death and dying, but nothing of what COVID caused, right?
Can I just?
So I can speak, just briefly, like from the social work lens, and as far as nursing homes go, it's another place where social workers are doing so much work, and they're, they're the unsung heroes. They're there, they're sitting at the bedside, they're supporting people, they're connecting with families. When this was first starting to happen, and there was the big crisis at the Holyoke Soldiers Home, EOHHS, the Executive Office of Health and Human Services, reached out to me and they said, hey, we need some more social workers. Do you know social workers who could come in? Like, they can't be remote, they have to come in and be on the ground. And I was like, I'm gonna try, we'll do our outreach to that part, to the Holyoke area of the state. And can I tell you, like, the response we got, all these social workers came forward. They said, I'll go. I was almost brought to tears, quite honestly, just to see, these are the people, this is why I'm so proud of the work that I get to do and the place where I get to do it, because I get to advocate for some of the most incredible people who really put themselves last sometimes, and other people first. So our job at NASW is to say, we're here for you, social workers. We lift up social workers and the clients and communities served by social workers. And nursing home social workers are often isolated. They're often the only social worker in a nursing home, and they're trying to manage everything that's going on in that setting and in that environment. So we do have a yearly nursing home social work conference. We had that virtually this year. It was really well attended. People got the opportunity from across the state to come together and share best practices and to lean on each other, because we know that's so needed in that field.
Rebekah, that's an amazing story. It's a really amazing story. I just want to add to that I think the point about having aging expertise in as one of the kinds of expertise we have on our advisory panels right now is incredibly important. I've been really disturbed and was actually, we're part of the Massachusetts Healthy Aging Collaborative. And we were talking about this at our last meeting, that we've been really disturbed at the messaging that even in this state, that we don't really have to worry so much, because in the early days of the pandemic, it was old people dying. And the message, and certainly that has happened from the person who is currently living in the White House, has messaged that quite a bit, right? Like, we don't need to worry because it's just old people, quote, dying. So I think it's really important for us to think about what our framing of the value of older persons' lives is. And this pandemic is giving us a real opportunity to pause and take a look at how we talk and think about the value of people who are aging, which, by the way, is all of us. But anyway.
If we're lucky, we will all age.
Yes.
Thank you. And it's interesting because that ageist perspective tends to, and sexist and so on and so forth, tends to replicate itself worldwide, where there are leaders who are, I'm thinking of some in Latin America, where I'm from, where they do take that perspective. Well, some people will have to die, will die, and we'll just live with that kind of cavalier attitude, which I think is disgusting. Before, we have only a couple of minutes. In just a few seconds, if each of you could say, given all the campaigns, all the things you've talked about and that needs to be paid attention, what might be one that you would tell this audience that you would like them to support right now passionately, or to pay extra attention to?
Go ahead.
Well, it's really hard to pick one thing. We have to get at structural racism. It's so important in the legislative session ahead that we're working on priorities and pieces of legislation that address upstream this problem. One of the things that we hope that, again, I mentioned this during the presentation, but that we hope that social workers will get involved in, is this effort to reduce police contact through enhancing community crisis response. So if that's something that interests you, we'd love to have your engagement and involvement in that work. We're also going to probably be putting more of a focus around trying to get police out of schools. So, we have school resource officers in all the schools. They're really are part of the school to prison pipeline, because they're police officers. Basically, can we get many of those folks replaced with social workers, people who can engage with students, who understand the community, and who can do that work. So if that's something that interests you too, we'd love to have your engagement. I would recommend that you take a look at our website, see what we're up to, find what you are passionate about, because when you're passionate about it, it kind of comes through, and you have knowledge and the understanding and the experience that you can lend to your advocacy work with us. So I would say, join us, be with us, and get involved in the issue that is of most interest to you and that you feel most passionately about.
I can just say ditto. I second that. There is a lot that's really immediate. The state budget right now is going to be one of the most important pieces of public health legislation, quite frankly, that passes this entire session. So we are right now, between now and Thanksgiving, that is all we're talking about, is how to make sure we have an equitable state budget. And then after that, there are lots of opportunities to impact our public health priorities going forward. So if you're interested in that, please visit our website, and there are a lot of opportunities there.
I want to thank both of you. You're so busy doing so much work, and here you are sharing your expertise, your knowledge, your wisdom, your passion with us. It's it's giving me a jolt of energy having you both here. I really sincerely, deeply thank you on behalf of the School of Social Work at Boston University, the Center for Innovation, Social Work, and Health. And before closing, I would be remiss not to acknowledge the hard work of our staff, Nalaja McCoy, who took the leadership organizing this event in partnership with so many people, Michelle Walsh in our marketing communications, Jeff Wilkinson, and a number of colleagues at the center who make this happen this evening. I want to thank all the participants for joining us late into the evening for this amazing presentation. Thank you, everyone. And I want to wish you a very good night and be safe. Thank you.
Thanks, everyone.
Thank you all, and thank you, Jorge, and the center. Really, it's been a pleasure.
Thank you both. Thank you.
The opportunity. Thanks so much. Bye.
Bye. Have a good night, everyone.